Each year, more than 1 million Americans choose to have total hip or knee replacement. And while their symptoms and problems may vary widely, most agree on one thing: they simply want to get back to enjoying life again. Today, the decision to receive a joint replacement is being made by adults of all ages. You're never too old or too young to alleviate the pain and get back to living life to its fullest.
It is worth the rest of your life to go through this operation and get it done. And don't worry about your age. Even if you're 90 and you're healthy, go for it.
95 to 96% of the people come back and tell you, I wish I hadn't waited so long.
For several years now, Nash has been named one of the state's top 10 joint replacement centers, and we continue to earn accolades from professional groups as well as our former patients. Certainly, part of the success here is the state-of-the-art Mayo Surgery Pavilion. And of course, the latest materials and technology have reduced recovery time and added years to the life of the actual joint replacements. But even more critical is the dedication of our doctors and staff. Every member of the Nash team shares one goal: to help you return to a full and active life.
The compliments I hear from patients who come back to see me is all about the care that they received and just the attention to detail, and they just can't say enough good about the therapist, the nursing staff, and so forth.
The nurses, the therapists, the lab staff, basically everybody from top to bottom here works together to make sure that the experience that the patient has is what they're looking for and that the results turn out well.
Their whole focus in the hospital is to make sure our patients get the best possible outcomes for the joint replacement surgery.
Along with top-notch doctors and nurses, Nash patients enjoy the most comprehensive and successful post-operative therapy to be found anywhere.
We love our job. We love what we do. We come to work every day with a smile. We love seeing our patients. We love helping them get back to their normal lives. And we just treat everybody like we would treat our own parents.
Receiving a new joint at Nash Joint Replacement Center is part of a process that begins long before the actual surgery.
What we try to do is focus on starting from the beginning, which is why they came in, and trying to treat people's symptoms in a manner that is not surgical related at the beginning.
Our aim is first to make certain that joint replacement is the best alternative for you. A thorough examination and x-rays can help determine the best course of action.
My personal philosophy is to have what I call a patient-centered approach. Everybody is different. Everybody comes to a decision to have surgery in a slightly different way.
If joint replacement is recommended, you become part of a small group that's considering joint replacement. We found that this team approach creates a spirit of encouragement and even a little competition that helps everyone involved in their healing and recovery process.
The whole Total Joint Center theme is basketball theme. We have hanging on our wall a drive to the basket. So what we'll do is each patient will have a basketball, and based on the patient's goals and the family goals, they'll set the goals in net all the way at the end of the board. And every day the patient walks farther and farther and farther closer to their goal. So it's like a friendly competition between patients.
You're out amongst other people, you're doing therapy with other people. It's a kind of a positive experience, more like a camp than it is going to the hospital, I think.
In most cases, patients are discharged 3 days after surgery. At that point, the recovery process continues with progressive exercise and walking programs. Your physicians and your therapist will assist in advancing each program based on your individual needs and goals. Very often, some group members become fast friends who stay in contact long after therapy is completed.
We'd always ask, how's Sylvia doing? How's Mr. Bumper doing? We'd go down the line and want to know how they doing.
Yeah, how's Richard doing?
Yeah. And then she'd holler sometimes, I can hear you over there.
Recently, 75 joint replacement patients, along with staff members of Nash Joint Replacement Center, gathered for the quarterly reunion luncheon.
We woke up and they were there to care for us. They would ask you, what can we do for you? I've never had that experience before.
I've never been treated so well in all my life.
It has been a wonderful trip for somebody who felt that I would never give up my joints. Oh no, not Yvonne Jackson. I got them, God gave them to me, and I was gonna die with them. Well, that was a lie. I got the liver, and I'm gonna die with it.
I think we have one of the greatest hospitals around. I think we're very fortunate to have a hospital.
If you're suffering from joint pain, Nash Joint Replacement Center can help you get back to a more active lifestyle. You have a lot of life ahead of you, so don't let joint pain steal away another precious minute.
Joint replacement surgery is a very safe operation, and it is actually an operation that carries some of the best outcomes we have in orthopedic surgery.
Basically, things are done the same every time, so the patients get that reproducible experience, and the results are very, very good.
I can guarantee you come up here, you will have compassion, you have the best care provided in the world.
I think it's been proven that total hip replacement is probably the most satisfying and gratifying operation and life-changing operation that a patient can have. And knee replacement is a little bit harder to get over than a hip replacement, but both change people's lifestyles when they do make the decision they want to have it done.
I think most would tell you that it has been the best thing they've done for themselves. They may not say that right away, but after they've done a few weeks or months of therapy, they realize it then.
Putting it off, the result is not good, because waiting and waiting doesn't improve your ability to recover from the surgery.
Why simply live with joint pain? Discuss the problem with your family doctor. You can also contact one of our orthopedic surgeons to discuss treatment options. Visit our website to see frequently asked questions concerning joint replacement. Just click on Services and then Joint Replacement. Or simply call us. Don't put it off. Now's the time to stop the pain and start getting back to enjoying life again.